Hey all, what's up everyone? Hi, this is harshadmenon and today we have a special guest with us. It's Dr. Chirag Thonse. He is a lead orthopedic surgeon in Vikram Hospital, Bangalore. He is also specialized in sports medicine, arthroscopy and joint replacement surgeries. Well, he has done his fellowship training in arthroscopy and joint replacement surgeries in various parts of India, Germany, Japan and Australia. Also, Dr. Chirag has got a vast experience in treating and operating on many elite sportsmen with various ligament injuries. Dr. Thonse has been actively involved in teaching and training programs. He also conducts domestic and international trainings in shoulder and knee surgeries. So please welcome Dr. Chirag Thonse. Hello,
Hi.
Doctor.
Yeah, hi, Harshad.
Hi.
Harshad, thank you for
So how are you,
inviting.
Doctor?
Yeah, I'm good. I'm good. I should thank you for inviting me to this wonderful chat session.
Uh-huh.
And let's see what best benefit we could render to our viewers.
Sure, sure. So, Doctor, how is it going? How is the lockdown treating you?
Lockdown is not treating any one of us well, isn't it? It's
Yeah.
probably, I would say, it's physically, mentally taxing.
Mhm.
And at the same time, it's a challenging situation for all of us, for the whole of the world.
Yes.
It's where we need to show our unity, strength, patience, and we need to get past this storm.
Yes, exactly. So, how is the situation there in Bangalore right now? I mean, in Mumbai, it's so, picking up. I mean, people are, there are a lot of cases and a lot of people are not going out. So, how is it in Bangalore?
Yeah, Bangalore is getting on a little better. The cases are on a decline.
Mhm.
We expect things to get better in the next couple of weeks' time, and the vaccination drive is going great swing. I hope everything falls back to normal as soon as we expect.
Okay. So, there are some people live. For all those people who are live, who are watching us, you can post in your queries as well. We'll be taking in questions. Do let us know. Also, we will continue with the stream session. So, Doctor, my first question would be there are a lot of people who are gaining weight due to lockdown. And what do you have to say about it? We'll start with the basics first.
Yeah,
Then we'll address about all the injuries that are happening, right?
yeah. So weight inactivity. So as the activity level declines, weight gain is one of the repercussions for that. So we all know that everybody's activity, irrespective of the profession, irrespective of the career, irrespective of the work what we are involved in, everybody's work or activity level has declined, which directly reflects on the body weight. Second is the stress. A stress level is directly proportional to the weight gain as well. So there are various factors which have direct repercussions of one's weight in this lockdown phase. We have been homebound, and sitting homebound with stress or with the workload which is lesser does cause in a lot of snacking, and this intermittent snacking is one of the major reason for weight gain.
Yes.
Yeah.
So basically, the major reason is your calorie surplus. So all the people who are sitting back home due to lack of activity, the calorie that they are able to burn is much less as compared to what they used to burn. So that's one of the reasons.
Yeah, that
Very
is
well said.
that's very much of a reason. I mean, we all know that the calorie intake for a normal individual on a routine basis for a young active male would be the calorie requirement would be about 2,500 to 3,000 calories per day. And this is on a normal scenario when a person is going to his office, when a person is performing his normal routine, and he is having his normal routine meals. Now, in today's
Mhm.
date, when the workload is lesser, when the activity level is lesser, definitely the calorie intake may be the same, but the calorie burnout or the outgoing is not as much, which directly reflects on the weight as well.
Yeah. So very true. So how does your working in home affect your posture? Basically, there are a lot of people who are working from home, and because of that, what is happening is they are continuously sitting on the chair, and we have seen a lot of cases wherein they are posture is the problem. So how do you want to address that problem?
See, Harshad, if we understand, ergonomics is nothing else but adjusting, it's a retrospect, adjusting the workspace according to one's requirement. This is the definition of ergonomics. And ergonomics has got a huge repercussion on one's health, right from the posture, the fatigue, the body pain and aches and everything is reflected to the ergonomic status. Now, work from home for a longer hours has does reflected into the musculoskeletal systems as well. There's a lot of musculoskeletal aches which have which the patients have been coming to us with, especially the upper back pain, the lower back pain, the trapeziitis, the neck issues, and so on and so forth. So it's very important that we pay importance to our ergonomic setup, like because most of them are working from home, they have long working hours, they are tirelessly working for longer hours, and this all directly reflects on their body. Now, a simple example is how does one work? They sit on their normal routine chair in front of the laptop, and they have this kind of a posture of a head stooping in front, which is not centered to the body, and this is a very toxic position or a posture. So this reflects on
Can
their.
you, I'm so sorry. Can you also show, the postures that you're supposed to maintain so that all the viewers who are watching in can also benefit from the same?
Yeah, so ideally, what one would have is one would have a chair, ergonomic chair with the backrest,
Okay.
and one needs to rest out their body to the chair. Second, they need to have a lumbar support. We do understand that the spine has certain curvatures, and to maintain the lumbar curvature is very, very important. Once your lumbar curvature is in place, the entire body is centralized. We need to remember that our chin has to be tucked in, and the head has to be centered to the pelvis. This is the right posture. Now we often see we just want to be relaxed. I mean, all of us, what I've been hearing from my patients who come to me with this musculoskeletal pains, they've been telling, doctor, I've been sitting in the dining chair, I've been sitting on the sofa and doing my work for longer hours, I've been lying down and doing my work for longer hours. This is a wrong posture. Now,
True.
what one needs to maintain is a 90-90 posture, a 90-90 posture, where even elevating your leg is not very, very advisable. One need to sit erect with the head centered over the body, a back, hip flex to 90 degrees and knee flex to 90 degrees. And this is the posture one would maintain, and this is what is very, very, very comfortable. Now, so there's something called the shoulder mouse syndrome. People are repeatedly using their mouse in one arm, and that causes a fatigue of your shoulder, and this is called the shoulder mouse syndrome.
Mhm.
Second thing, what I see patients coming with a lot of the trapezius, this muscle goes in for a fatigue, and they're tender and inflamed and sore. That's because of the posture what they're sitting in. With a laptop, you don't have much of an liberty to change the monitor place, because you will then have to change your keypad as well. So what I would
Mhm.
suggest, if somebody has a cable which can be connected to a normal regular monitor,
Mhm.
use that and keep it elevated. Now, the right position of keeping your laptop is at your eye level, where you are looking at the monitor at about 40 to 45 degrees decline. On
Okay.
simple terms, your eyebrow should be in the upper margin of your monitor. This is the ideal posture,
Okay.
which would reduce the fatigue over the neck and the shoulder. This is something which we need to probably do a few adjustments. One,
Mhm.
invest on a good chair. Yeah, as I said, something with a lumbar support. It's worthwhile investing on a good chair. Third is
Mhm.
independently get up. I would say every half an hour, get up, walk around, do some stretches, get back to your chair, and that would be ideal thing to do in these kind of longer sitting hours time.
Mhm. Okay. So basically, one key mention that you have mentioned is a chair, a perfect chair, along with the that can help you with the posture.
Yeah.
So an average height of the Indian chair that we use is around 18 to 20 inches. That's from the ground. So you have to set up your height of the desktop in such a manner that your eyebrow is coming below that, so that you can look at it at a 45-degree angle. So that
Yeah.
would be something around 30 inches high. So people, you have to take note of this. This is what doctor is suggesting. And also when you're sitting, sit properly such that your lumbar spine, that's like touching the back of the chair, and so that your chin is also tucked in, your shoulder coming out like this,
Head
and okay,
centered. Head
head is
centered.
centered. Head is centered. So, doctor, there are also some people who use a mouse pad, or they keep something soft. So, what do you recommend about that for using a mouse? What is the perfect thing that they
See,
can use?
see, that's what I was talking about, a shoulder mouse syndrome. This is very common.
Mhm.
If you do not have a hand rest, so ideally you
Mhm.
should have a hand rest, which would take
Mhm.
away the excess load on your shoulder and your upper body muscles.
Mhm.
So
Okay.
mouse is something inevitable, isn't it? We do not have an alternate. Most of them do not have an alternate. Of course, some of them do have touch laptops, but then
Mhm. So, okay. So this is one more problem that people are facing right now, since you mentioned the posture, the right posture. But coming back to something which is a wrong posture. For example, there are some people who sit like this, and because of that, when they're working, they find it comfortable, and your body adjusts in such a manner that you always want to be comfortable, and the muscles around it will want to basically adjust here and there, and it will make you comfortable for that time. In doing so, you will see that all the people have problems with this muscle. They start stooping down. So do you recommend some kind of exercises for those people?
see a simple basic exercise for anybody sitting for longer hours. I would say get up in the morning and do a lot of chin tucks. Do a lot of chin tucks. Yes, cervical spine extensions. Yeah, do scapular retractions and shoulder shrugs. Now, yeah, yeah. No, now we need to remember one thing. Our lumbo-pelvic core muscles is
Mm-hmm.
the lighthouse for the body posture.
Mm-hmm.
Now, if you do not have a good lumbo-pelvic core muscle
Mm-hmm.
strength, your entire body posture doesn't sustain itself.
Okay.
So that should be the key for anybody to work on. And if we want a good posture, we need to have a good lumbo-pelvic core muscles, including the glute muscles. And once you strengthen that with various forms of your exercise program, your posture will invariably get corrected.
So what you suggest is at least 20 to 30 minutes of workout every day for everyone.
Yeah, yeah. And also we need to reduce our abdomen fat.
Okay, you mean belly fat.
Yeah. Fatless abdomen is one of the key reasons why one person has a bad posture. Of course, fatigue is another issue altogether. If you do not get adequate sleep. Now, I've seen some of my patients. They say that doctor, I'm working late hours, so I'm having energy drinks in the night. So this is
Mhm.
not a good idea because energy drinks do contain caffeine
Yeah.
and they hamper our sleep. Now, a hampered sleep indirectly reflects on eating habits. There will be frequent snacking in the nights, which is not advisable. Indirectly leads on to the weight gain. Inappropriate sleep also directly causes weight gain. And third, inadequate sleep also causes fatigue. And this fatigue causes a generalized fatigue of the body, and one to maintain the posture next day morning is not possible. Body automatically
So
goes into slouch posture.
So, since you mentioned about sleep and people not getting sleep, I get a lot of clients who ask me basically that they sleep at around 5 in the morning, 6 in the morning, and they say that because of the lockdown they are not in the mental uh, straight. They're not mentally prepared and they're not able to handle the stress. So because of that, they're sleeping late. So what are the ways that people can cut short of those, that time frame from 6 to 5, make it 5 to 4, and start getting back on track, like around sleeping at around 1 or 2 at least for now.
We know that the best sleeping hour in a normal circumstances for a body is between 2 to 6. This is called the golden sleep hours.
Golden sleep.
And even if you get a 4 hour of good sleep in this interval, that's good for your body rather than sleeping in bits and pieces, sleeping in the morning for 2 hours, afternoon for 2 hours, which is not very healthy for the mind and the body. So one needs to devise their own program for this. I mean, there will be people who will be working late night and who cannot sleep, and next day morning they're fatigued. So this causes irritability, this causes mental stress, this causes body fatigue, and definitely it's not very healthy. They need to revise their sleep cycle, make adjustments in their work if possible. If that is not possible, then they need to figure out at least on an alternate days they can get sleep during this time. And one more important thing is that sleep is best gotten in a dark room.
Okay.
The
That's
best.
because the melatonin secretion is better.
Yes, yes, very much.
And also, you were talking about the time frame, the 2 to 6 people. That is because your rapid eye movement, that's REM sleep, is the
Yes,
highest at that period
yes,
of time.
yes, exactly.
Yeah. So you should focus on sleeping from 2 to 6.
Yes.
Uh, okay, there is a question. I'm so sorry. What type of bed should we use for sleeping? A hard bed, a soft bed, or a spring bed? I think the person is asking about a coir bed.
Yes. So what it is subjective, as in what problem the patient is facing. If it's a normal individual without any problems, he can use any bed.
Uh-huh.
Hmm? If it is somebody who's got back issues, what I would suggest them is to use a semi-rigid bed like a coir mattress.
Uh-huh.
Of course, elderly patients who have got a lot of rigidity in their muscles and body, they can go in for a memory foam mattress, which is much more comfortable, and at least that will get them a good sleep. Now, as important as the mattress is the importance of a pillow. So it's very very important. Good pillow selection is something which is very important based on what
So
what age group the
you
patient
recommend
like.
a memory foam for a pillow as well?
Memory foam pillow is a very very good pillow. It has a very good impact on your cervical spine and your upper body.
Hmm.
So memory
Hmm.
foam pillow is something which I use.
Okay. So the doctor uses memory foam pillow. Take care. Take note of this.
So
Yeah.
I'm not advocating or advertising for a particular pillow, but in normal circumstances, it's a good pillow to be used. But we need to remember that people with cervical spine problems, the doctor will suggest them accordingly. Some people, it may not be advisable to use a pillow. Just rolling a towel and keeping it in the cervical spine up could be a good idea for people with cervical spondylosis. People with rigid spine using a thick pillow with a little bit of neck flexion would prevent them from getting these frequent headaches and things like that. So it is subjective. I mean, on a
Mhm.
normal scenario, memory foam is something which is good enough.
Okay. So there is one question since you mentioned about cervical patients. So for all those patients, cervical patients, when they're sitting and working back from home, what are the exercises that you would recommend for them to do? For example, you mentioned about the scapula, the shoulder shrug, and the neck tap. So what are the exercises that are very specific for them? Because they frequently get episodes because of the stress and all the factors that they're facing right now.
See, exercises during lockdown you're talking about, isn't it?
Yeah, yeah.
Yeah, exercise. See, it's all homebound exercises now. You definitely we
Hmm.
cannot go out. One cannot cycle. One cannot run. One cannot go to the gym. So it's all. It should be a combination. Now, if on this now during lockdown period, if somebody is serious about their health and if somebody
Hmm.
is wanting to get into a good exercise regime, one would want to maintain their body weight without putting on excess weight. One would recommend to exercise at least 45 minutes to 1 hour a day. And this exercise regime should include stretches, it should include cardio exercises, it should include weight training, and it should include endurance exercises. Now,
Okay.
to start off with, the simple spot running or skipping is very good. Now, if you know that if you can just recollect, a simple spot jogging or skipping burns around 20 calories in 10 minutes. So if
Continue.
somebody is spot jogging for an hour, that's a good exercise to lose weight. Skipping is also it's an actual force on your body, so it strengthens your muscles, it tones your calf muscles, it tones your hamstring, your glutes, your pelvic core, and it's got a good impact on your bone. So this is a simple set of exercise what one could start off with. Of course, push-ups has got a lot of benefits, right from your pectoralis, your deltoids, your arm muscles, your shoulder, your core muscles of your abdomen, and also your glutes and hamstrings are all involved in doing a simple push-ups.
Mhm.
One could include that in your exercise regime. Now, we all know that planks. Planks is a wonderful endurance
Swimming
exercise.
pool, yeah.
Of course, yeah, planking doesn't burn much calories. 1 minute of planking burns about three calories. That's all. But this is more of an endurance exercise program. Now, hence, I would really suggest that planking for some at least about 10 to 15 minutes intermittently would really give you a core strength. Now, the planks also work on your pelvic, abdomen, glute, your entire body core. Hence it automatically corrects your posture. It takes care of your back pain. Planks do take care of a lot of back pain. Along with that, one could do a lot of these endurance exercises are there. Whichever your trainer would suggest, one could go ahead and do those kind of an exercise program. Uh, what ideally is suggested is to do a bit of a circuit training, a quick circuit training of people for people who are seeking for weight loss, which includes a little bit of a cardio, a little bit of weights. Resistant band exercises is something which one can do at home. One could use the resistant band according to what one can tolerate, and that could not only improve your flexibility of a muscle, it also gives you a stretchability of the muscle, and this really helps you overall. Now, it's very important how we start our exercises and how we end it. Warm up is important, as well as cool down is important. Now, I would say invest about 2 times the time of warm up in your cool down. This is very important to prevent injuries for people doing exercises without a trainer. Now, it's a difficult task to get on a trainer coming to you, or you going to them and doing your exercises. So, this is one simple step to prevent injuries. Second, drink a lot of water. Drink 1 pint of water before your workout. Drink a glass of water in about 20 minutes from your workout, and drink 2 pints of water after your workout. This will prevent dehydration. Now, what happens if you get dehydrated? You have muscle cramps, you have body fatigue, your uric acid level increases. So it's very important with your home exercises you hydrate yourself. Third, stretches. Now, stretches to a point where you feel the pain, but stretches to a limit where you can tolerate pain. Do you follow? This is very important. Now, stretches to a point where you get the pain, stretch to a point where you realize the pain. So this is where we need to know where to put an end to the exercise regime or the stretches. Now, this is, as I said, stretching, strengthening, cardio program. So it has to be a comprehensive exercise program what one needs to involve in your daily routine, and this all can be done in a matter of 45 minutes.
So people, what doctor is trying to say is start your exercise with dynamic stretches, and if you're investing 5 minutes of dynamic stretches, then you can go on with your regular workouts, and then when you're finishing your routine, include static stretches. That is very important, and you need to include about given 5 to 10 minutes for your static stretches so that you can cool down your body. And also, doctor mentioned that you need to take your stretches very seriously. Doctor, what is the ideal time that you would recommend? Because studies shows that somewhere for your static stretches, your 10 seconds to 60 seconds can be done for your stretches, but then that is very, subjective for people to people, because someone who is starting new, they would find it to be very painful, matter of 15 seconds or 20 seconds. For someone who is experienced, they might hold it for 60 seconds. So what is your say on that?
No, 10 to 15 seconds is what is suggested.
Yeah,
Ideally,
ideally, yes, yes.
10 to
So
15 seconds what you suggest ideally. This is the
yes,
time frame
exactly.
what stretch has to be. Now, if I'm stretching it for 2 seconds, doesn't make any sense. And if I'm stretching it out beyond the 15 seconds, that too makes no sense. So 10 to 15 seconds is something which is suggested.
The ideal range. But then there are some people who would say, keep it stretched for 60 seconds as well. That is not ideal. Yeah.
Yeah, see,
That's subjective.
Harshit, we need to understand that your flexibility and endurance level is different from
Exactly.
mine. I mean, from everybody, every individual is different. So each person needs to realize what their limits are.
Uh-huh.
And you're into a fitness industry, and you are well trained, well toned, and you have a regime which you follow for many years.
Mhm.
So that may not be applicable for people who are just starting off their exercise regime. I mean,
Yeah. In short, people, what you need to do is understand your body, listen to your body, and just do not, try to push it without thinking. You need to take a heed of your body's advice and notice, right?
yeah, just
The
to add on
science.
here, yeah, just to add on here, since we are talking about people who are just getting introduced into their self exercise program during this lockdown without much of an guidance,
Mhm.
I would suggest them to concentrate more on your posterior chain. Now, what your posterior chain is your lumbar spine, yes, your glutes, your hamstring, and your calf. It is as important as your upper body exercise. Now, what a common mistake what I see my patients coming in and telling me here is, doctor, I do a lot of upper body exercise. I mean, I do 5 times a week. And when I ask them, what do you do for your back and your posterior chain? I mean, they're like, I do squats. That's it. Now that doesn't really make sense. I mean, you need to invest enough time on a posterior chain, because that one, it gives you a good posture. Second, it gives you a good endurance, and third, it gives you a good core, which is very important.
Mhm. So, your posterior chain is as important as your anterior chain. That is one thing that people need to understand. And squats is definitely a very good exercise. It's a compound movement, but then it does not address to all the problems or all the muscles. It does not tend to all your muscles. So people need to understand that you will have to isolate your muscles as well and then work accordingly. Yeah. So, doctor, what I wanted to ask is, getting coming back to injuries, what are the common injuries that that are caused with when it comes to athletes? Maybe the weightlifters or people who are engaging in sports, say a footballer, a runner. In general, what are the one or two injuries that normally happen?
So I'm talking about normal circumstances, not in the lockdown phase, because nobody is
No,
playing now.
yeah, right now
In
also.
a normal circumstances, most of the injuries are activity related. Now we have two kinds of injuries. One is what we call as contact injuries, and one is
Mhm.
non-contact injuries. Now, people who are involved in hard sports like football, rugby, or any one of these kind of sports are
Yeah,
more prone to have
contact.
a contact injury,
Mhm.
like a direct hit. So
Mhm.
these patients can get probably a muscle contusion, a broken bone, that's a fracture, or any kind of impact injury. They can also have injuries to the knee or shoulder, like a shoulder dislocation. They can have a impact to the knee and tear one of their ligaments. So these all fall into the contact injury kind of pattern. Now the non-contact injuries are injuries purely because of the sporting mechanism, like somebody who is involved in squash or badminton, or else who is involved in high jump. So these people usually, or people who are involved in high pivoting activities, these have got different form of injuries. Like I would say ACL tear is very common in footballers, or it's
Yeah.
very common in badminton players, because there is this kind of a pivoting activity, and if they're not balanced enough, they can have a differential rotation of their knee and they can tear their ACL ligament, or they can have a rupture of their meniscus. So this is kind of a complex injury which will definitely require some amount of treatment and maybe surgical or not. Now we are also talking about sports persons who are involved in weight training, like weightlifters or
Weightlifters,
bodybuilders, uh,
powerlifters.
powerlifters. So they have a different set of injuries. They can have a muscle tear. Like I have seen people even have a complete quadriceps rupture by
Oh,
lifting weights,
while lifting
because
weights.
of, yeah, because of various reasons, because of their habits of their diet and things like that, they're more prone for ligament and tendon injuries, some of them muscle ruptures. They can have a lot of shoulder injuries. They can have disc herniations if they do not have a good posture when they're doing their weight
When
training.
deadlifting.
One can have a herniated disc, a disc prolapse, and that could lead on to a sciatica pain and so on and so forth. So it's a wide spectrum. Now runners are a different subset altogether. They have more of a foot problems. They can have ankle injuries, ankle sprains, ankle ligament injuries. They can have something called the insertion tendinitis of a tendo-Achilles, back of the heel where the tendo-Achilles.
Achilles tendon.
Yeah, Achilles tendinitis. They can have a small spur in the back of the heel, which is called the retrocalcaneal spur. They can have plantar pains. Inappropriate footwear can lead to a heel pain, a soreness of the heel, and this is called the plantar fasciitis. If the plantar fasciitis is neglected for a long time, they can have heel spurs.
Mhm.
So this is the spectrum of injuries which sportsmen can encounter. As simple, a tennis player can have because they frequently lunge with their
Yeah.
shot. They can have anterior knee pain syndrome where there's a soreness of your kneecap, and every time they
Kneecap.
climb stairs or squat and get up, they'll have this kind of a soreness in their knee. So these are the spectrum of injuries what one can encounter.
Mhm. So we have a question. Good evening, sir. Sir, I have serious problems of cervical spondylitis. My condition is being worsened day by day. So can you recommend one or two points? I'm very sure you've already cleared it, but then if you can clear one or two points for him, he'll be happy.
Yeah,
Just two, three points,
yes,
yeah, that he needs to take care on daily basis.
cervical spondylosis is a broader term to be used. It is nothing else to be putting it in a simpler term. It is the early wear of your cervical bone, and this is basically it's a posture related, hereditary, and ergonomic issue. It's a wear and tear which can cause stiffness of the neck. It can cause lack of movement. It can cause rigidity. It can cause pain. In severe conditions, it can cause radiating pain to your arm. Now we need to. It's very important that this individual who is asking the question visits his orthopedic surgeon, gets an X-ray done. Most of the cervical spondylotic issues are sorted out with good physiotherapy and a good rehab program with some supplements, posture change, and ergonomic changes. In extreme conditions, they may require something else, but this is how the guidelines. How one would treat a cervical spondylosis.
So Vishal, doctor says that you need to visit the nearest possible doctor, or I think doctor is taking online consultations as well. So you can call him up later. I'll share all the details. But you need to take care of your posture for now. Anyways, coming back, uh, doctor, what since you addressed what are the common injuries that normal people or the weightlifters face in general, what are the, for example, say if someone has got disc herniation, so what do you normally recommend for all those people?
See, a disc herniation can be of various grade. It can be just a disc bulge, it can be a disc protrusion, or else a complete disc which has come out. It's called a disc extrusion.
Hmm.
Now, it can happen over a period of time. It can be a gradual onset and progression, or else it could be acute sitting. One fine day, somebody is lifting weight and he has a sudden pain or catch in the back. He is bent towards one side and he's got a sharp shooting pain coming down the legs. This is a warning, alarming sign. Now, if anybody has done an undue activity, sudden weights, and he's got this acute pain which is throbbing down his leg, this is something which cannot be neglected, and there are no home remedies for this. He needs to immediately see the doctor. Second alarming feature here is if somebody has kind of a burning or tingling numbness in his foot, or else somebody has a weakness in his foot. This is again an alarming sign, and one needs to see a doctor. Now, most of these disc herniations are treated conservatively with the rest, with probably a brace, with posture correction, and some amount of physiotherapy and medications. In rare circumstances, when you have a severe radiculopathy, as I said, sciatica, pain, or else a weakness or numbness in the foot, one would definitely require a surgical intervention. So it's very important that one seeks the right advice and gets treated accordingly.
Uh, how has the dynamics changed due to COVID with regards to activity? Because right now there are a lot of people who wants to work out, but they're not able to work out, and they say that they're not in a frame of mind to work out back at their place because they're not able to. So, what kind of exercises would you recommend?
See, Harshad, health is a state of mind, and we
Yeah,
know everybody's state of mind is changed in this last 1 year. There
exactly.
is a lot of negativity around us. There's a lot of depression. There's a lot of negative energy which is floating around. We need to get past this. And
Let's have a fast
and
time.
a person's state of mind directly reflects on its health. We need to remember this, and we need to be mentally strong before becoming physically strong.
Mhm.
Once we have made a mindset that we need to get into a, and I would say we should take this time frame as a blessing in disguise for all the people who have been busy, who have not been able to put enough time into their health, who have not been able to put enough time into their workout regime. They can take this as a right time to start off your exercise program. I mean, as I said, simple exercise therapies. You do not need to have equipments to start off with. Simple body weight training is something one could do. Push-ups, half sit-ups, wall assisted sit-ups, planks, burpees. You can order a elastic band, resistance band online, and elastic band is a wonderful tool. Now one could use a bar and pull-up bar, which is available,
Pull up.
and one could just fit it into your ceiling, and you can start doing your pull-ups. And now pull-ups and push-ups are wonderful body weight training exercises. Sit-ups does give the entire lower body exercise. Lunges is something one could do. One could do your triceps exercises with the simple chair.
Resistance band.
Yeah. So one doesn't need equipment. It's just like we need to, as you said, it's all.
They just need to invest time
Yeah,
on themselves. Yeah.
yeah. We need to start.
You need to start somewhere.
Yeah, need to start somewhere.
So, we have a question. Does lack of vitamin D result in back pain?
See, vitamin D has got a lot of repercussion. I mean, it's got a lot of effect on the body in the whole. Now we know that vitamin D does have a lot of positive effect on the muscles and bones. It enhances the bone formation. It prevents muscle aches and cramps. It's also a wonderful antioxidant. Generally, it's a very good cell-forming element. Now, vitamin D deficiency can indirectly cause calcium deficiency. It can cause weak bones. It can cause muscle cramps, and it can cause a generalized fatigue. So it's very
Uh,
important that since a lot of us have been indoor in the last 1 year, it's a good idea to get your vitamin D tested. Even if you do not have a facility or you cannot go to a lab, you can definitely start on taking your vitamin D supplements.
okay.
Now, a lot of foods have vitamin D. Usually,
Egg
yeah,
would be one.
yeah, like fishes, like salmon, mackerel, all of these do have sardines, are rich in vitamin D. Dairy products, cheese, milk,
But then nothing can beat the natural sun rays.
these are the natural ingredients which are. But yeah, of course,
Yeah.
we may require the daily requirement may be a little more than what we can consume. Broccoli is good, so beans are good. So all these are vitamin D rich food. So if we do not consume enough of this, we can always go in for supplements like
Okay.
60,000 international units per month.
IU per month.
Yeah, if you have deficiency per week, 60,000
Per
international.
week. Yeah.
Yeah, but as a maintenance dose, 60,000 per month.
But then studies also shows that doctor taking about 2000 IU a day has shown better absorption, and also it works wonders in case of all the athletes and all those people as well.
Yeah,
Correct?
yeah.
What
So,
do you have to
so,
say about that?
so what we recommend nowadays is a sustained dose. Rather than giving a bolus dose, which
Yeah.
absorption may not be wholly there. Now, if you are consuming 60,000 international units, the absorption due to various reasons may be only 30 or 40,000 international units, rather than that going for daily titrated dose of 2000 IU.
Mhm.
Add it on with the calcium. It's very important that we add it on with the calcium.
So that it increases the absorption.
Yeah, yeah. At the same
Okay.
time, if somebody has this muscle cramps, it could be one of the reasons. Also, could be dehydration. Second
Mhm.
is in this season, particularly what I have seen, a uric acid elevation
Uh-huh.
because of food habits and dehydration. Most of the younger guys come to me with muscle cramps, body aches, joint pains, and when we see the
Joint
uric
pain.
acid is really shot up.
Mhm.
So that is something which we need to keep in mind.
Yeah. So there's one more question. After ACL surgery, can we start doing yoga? And are there any such exercises that need to be avoided?
Now, what time frame of ACL surgery are we looking into? So definitely yes. ACL surgeries in today's date are one of the most satisfying surgeries where an unstable knee becomes a stable knee post
Stable.
surgery. And a person who is not able to run, pivot, play sports is able to do that after the surgery. But of course, there's
Mhm.
a timeline of recovery. There's a timeline of recovery based on what kind of a surgery is being done, what kind of a graft is being used, what is the body profile of the patient. Your operating surgeon will be the right person. But in a nutshell, at about the end of 1 year, a patient is able to play all his normal routine sports, including pivoting sports, if with a successful surgery.
So, Santosh, you need to start workouts and all those things once after you consult your doctor because it depends
Rehab.
on what kind of surgery you had.
A good
Yeah,
rehab and strength and conditioning post surgery is very important.
yeah. You also need to start your physiotherapy exercises in order to begin with so that you can strengthen out your knee and start with all those exercises first. Then, doctor, can you also please put some light on difference between sprain and strain? That's one of the other questions.
Yeah, so to completely separate out two things, now a muscle is a strain. When you have an injury or a pull of a muscle, it's called as a strain.
Hmm.
When you have an overstretch out of a ligament, it is called as a sprain. A tendon or a ligament is sprained, whereas the muscle is strained. Strain is an overload,
Okay.
whereas sprain is an overstretch. Simple.
So basically, you mean to say strain is caused for muscles and
Sprain
sprain
is
is caused for
ligaments.
tendons.
Ligaments. Yeah, ligaments.
Okay. So, doctor, any drills that you can show, a short 1 minute drill that you can show for all those people who can start with their workouts, like some stretches for, I'll name. Okay, you're not in a
I'm
position.
in my office and it's
Okay, okay, no worries, no worries. I can take a
yeah.
session for that later.
So
No worries.
we can always talk about whichever exercise program. Like each one of them has their own benefits and non-benefits. I mean, like I frequently keep getting a lot of queries. Doctor, can I do planks? Can I do a panther shoulder tap? Can I do a dead bug? Can I do a butterfly sit up? So these are all like fancy names given for core stability exercises, basically.
Yeah,
So we need to choose the simplest of the exercise what we can.
to
Now the
begin with.
yeah, kettlebell is a simple exercise one could do. It's a very handy exercise tool without much of an investment. So this is something which may really help us. One can use the elastic band for
Resistance.
various programs. So it's up to us what we actually want to into.
So, doctor, everyone addresses the posterior and the anterior chain, and the glutes, the core, and all those muscles, but nobody really talks about the abductor muscle and the adductor muscle.
Hmm.
So, how important is it to train your abductor and your adductor muscles as well?
See, it's very important. Like, if you're involved in active sports, now for a sportsman, it's very, very important. Of course, for a
Yes,
sportsman,
yes.
it's very important. Now, adductors basically are your gracilis and your hamstrings. What brings about adduction is your gracilis and your hamstrings. And what brings about abduction is basically your glute muscles, the augmented glute muscles. So for a good posture in walking, for a good posture in running, for a generalized proprioception or a balancing activity, you need to have abductors and adductors as well. So, how many of us actually do your abductor curls? We just go do our quadriceps curls, our hamstring curls, and abductor curls are out. So, simple thing what one could do is lie of the of your body and do a lot of abduction. One.
Basically,
Second is,
clamshell exercises.
yes, yes. Adduction in the same way. You can use the elastic band, the resistance band, and do a lot of your adduction exercises. So this will, one is, it will improve your gait. I've seen drastic improvement in patients' gait. I mean, what I'm talking is the post-surgery, but even in a normal individual, it really enhances one's gait. It improves one's posture, and it prevents injuries. Now we see a lot of hamstring and adductor injuries in people, in runners, in people, in weightlifters. They come and 3 weeks they're out after that. If you have a sprain of this muscle,
Yeah.
this can be this these catastrophes can be prevented.
Hmm. Yeah. There is one question: how to ensure we don't hurt ourselves during workouts or dancing, etc.
A body balancing program. This is a key. This is a key. If you are involved in any form of a pivoting, like, you are a dancer or you are a pivoter who does a lot of pivoting activities, especially in dances. If I would say, if you're nowadays, I see all these dance shows, and I wonder how flexible these people are and how they land on one feet and how they balance their body. It's fantastic. It's tremendous. But at the same time, I get a lot of people who are dancing and having their ACL stone. Now that's a disaster, because 1 year after that you're out of your dancing activity. So why this happens is when you have a misbalance. So in case you are working out regularly, you should inculcate a neuromuscular coordination, or else your balancing program, what we call as a proprioception. Use a wobble board, use a Swiss ball, a single leg standing, single leg hopping,
Bosu
single
ball.
leg jumps. So, and also standing on a wobble board single leg. So this gives us an idea of how much of your agonist and antagonist muscles are acting and working well. Now, if you have a good quadriceps and if you do not have a good hamstrings, that
Hamstrings.
again is a predisposition
There's
for,
the tight muscle, and then because of that,
yeah,
yeah, it
yeah.
will
So you
cause
can buckle and
misbalance.
fall. Now, as you said, if you do not have a good adductor, that's again doesn't balance you well. So it's very important that one needs to have a complete strengthening and of course the balancing. So proprioception exercises is something which will prevent you from injuries in dancing.
Okay, so here's the answer. You need to train in such a manner that you can work out all those muscles which you'll be engaging during your dancing protocols, and you will have to give in a dedicated amount of time so that you can train all those muscles. You have to focus on all the muscles. You just cannot directly start with the act.
And
That is
let
what
me
the
add on,
doctor.
Harshad, here. Let me add on. See, by what I see, most of the dancers who have such amount of flexibility are inherently hyperlax. In the sense, anybody who is able to, like a simple test, if somebody is able to get their elbow straight more than what is straight,
Yeah,
or if somebody is able to touch their
touch this.
hand here. So these are people who are hyperlax. And these people are very good gymnasts and they're very good dancers. But at the same time, they are prone for injuries. They're prone for ligament tears. So they have to be a little careful and they have to train accordingly. They need to have a good strength and conditioning coach. They need to visit a good physiotherapist. They need to get their assessment done. And it's, as I said, it's a double-edged sword. You can perform well as you are injury prone. So you need to have a good balance between these two.
Uh-huh. Okay. So now, nowadays, there are a lot of football turfs which are coming up in all most of the societies and all those places. So, because of this, a lot of people are getting injured because since it's a confined space, they, as you mentioned, there is a contact sport that is happening, and they end up injuring themselves. So, and also in case of footballers, they end up kicking their metatarsal head, and they're not able to walk after that. They do the protocols like the RICE protocol, the resting, icing, compression, and elevation, but then still after that, they're not able to walk properly after 6 to 7 months. So, what do you recommend in such kind of cases?
See, especially in Bangalore, we've over the period of last 2 to 3 years, we have seen probably a explosion of sports arena. I mean, in the sense there are so many new sports arenas which have opened up. Basically, because the sporting activities of younger kids have increased so much. Everybody wants to get into sports, and easy access for somebody to play is the indoor sports ground or also indoor turf stadiums, and most of them have synthetic turf. Now, synthetic turf, what I have seen, if it's not well maintained, they can create a lot of problems in the sense the patient's foot or the stud of the boy can get entangled in these in the area where they join this turf floors, and they can have a twisting injury of the ankle, they can have a twisting injury of the knee, and they can have ligament ruptures. One. Second is if the footwear is not good, that again can cause a lot of foot problems in these kind of sports. So as you said, an inappropriate footwear. You told me about the metatarsal head pains. These are all called stress injuries, a repetitive stress injury. So a bad footwear with the repetitive sport, which involves the foot landing, will cause stress injuries to the foot. Likewise, a badly maintained turf can cause entanglement of the foot and cause ankle or knee ligament ruptures,
Okay.
ACL tears. Very
A
common.
follow-up question someone has asked, how do we select which shoe to buy for weight training if we have flat foot?
You need to, I mean, flat foot or foot pronation. Now we need to differentiate between a foot pronation and a flat foot. Flat foot is a foot which is flat even when you're lifting it up the floor without putting weight. If you still have a collapsed arch, that is a flat foot. Now when you put your foot on the floor with your weight, and when you stand, if only the backside of your foot is kind of everted out, and then you also have a collapsed arch. This is a combination of a partial flat foot and a foot pronation. And now it's ideally on normal circumstances. Now we have a lot of foot assessment centers which are accessible.
Yeah.
Rather than just using a random footwear or an insole, it is always better to get a foot assessment done to know your pressure points, to know where your arch is collapsed, and to get a custom-made footwear is something which I would, especially in players, it's very handy and it's very helpful. This will prevent any form of an ankle swelling. So what happens with a persistently untreated flat foot or a foot pronation? The surrounding tendons of your ankle can get inflamed and sore. Then comes the ankle swelling, then comes the foot pain. Some people can get plantar fasciitis, heel pain. It leads on to a lot of
A lot of
surrounding
problems.
tissue damage and inflammation. Yeah, yeah. So it's first step is to go get your foot assessment done and get your appropriate insoles.
So, what the doctor says is get a, go to the store, just check it out. What, according to the type of the leg that you have, the feet that you have, then you can select the type of shoe.
And
But yeah, doctor, you
in
want to add
today's date, most of the good footwears whichever come with some amount of medial arch support.
up?
They're all anatomical insoles, most of them. But each flat foot is different, and it's best to be assessed and treated.
Okay. So post-COVID, we tend to be very tired. But how can an obese person stay healthy too and doesn't increase their weight? This is one of the questions.
See the post viral fatigue is a common phenomenon. Even in the past, people who have had viral fevers have got fatigue. Who have had dengue have had generalized fatigue. The malaise, it's like a generalized fatigue, disinterest, and inactivity level of the body. Now, one of the simpler ways to get out of this is a good diet and a good sleep. Now, your diet should include enough amount of carbohydrates, enough amount of proteins, and lot of antioxidant food. Now, also in injured people or in people post-COVID, including a little bit of nitrates in the food is also very, very important. It really helps you recover well.
Recovery is fast.
Yeah, recovery as well. Now, what usually I tell my patients, because post-COVID they're apprehensive where I'm going to put on weight and things like that. They tend to eat more of proteins and cut down on carbohydrates, which is not right. I mean, we can get our body to be a little active. Active in the sense it's not necessarily that you need to do a lot of your exercises and things like that. Just be active for the time frame where you were active before. If you are a person who was working from 8 o'clock to 10 o'clock, be active. Be active in the sense be awake. Do your housework. Help your house people in the kitchen. Do a little bit of cooking. Be up and about. Walk when you talk. If you are on the phone, walk and talk. So this gives you adequate number of steps and burns out a little bit of calorie and keeps your muscles flexible. Second, eat healthy food. Include a lot of vegetables. Carbohydrates should your calories which are required for the day. At least 52% of that should come from carbohydrates. Less can come. Rest of that can come from your proteins and fat. Eat good fat. Don't use trans fat. Try taking in more of unsaturated fats. Include grains and beans in your diet. Have tender coconuts. Have a lot of antioxidants like grapes, oranges, gooseberries. If you're a non-vegetarian, you can take in a lot of omega-3 fatty acids in your food, like your fish products and things like fish liver oil. All these are rich in these things. Basically, you need to have a good diet, eating habits, good exercise regime, and good sleep. So these three are the key for recovery post-COVID.
Uh, I think that is the key point for everyone, and that is the key point for all the things as well. Yeah. And there's one more follow-up question. After an ACL and bucket handle meniscus surgery, now it's been 6 months of my surgery. Still, I am not able to sit down completely with fold legs. Can you suggest me how to overcome it?
Harshad, I think we should have a session on ACL.
Seriously, we'll give a dedicated session on ACL.
Yeah. So ACL is a very very important ligament, as well as this person whoever is asking the question has had
No,
a
it's different people.
huh?
All the people who have asked me about ACL, all of them are different people, by the way.
Yes.
So I think there are a lot of people who wants to know about ACL.
Yeah. So now we understand that the ACL injuries are so common.
Yeah.
So now post ACL injuries, usually in today's date where the rehabilitation is good and the surgical techniques have improved, it's all a keyhole surgery. Even your meniscus is repaired or stitched in a keyhole fashion. So early rehab program gives a good flexibility, and usually patients do achieve their full range of movement in a matter of 2 or 3 months time.
Uh-huh.
Uh, uh, I do not know if the person has done his rehab, has undergone physiotherapy, has consulted his doctor regularly. So there could be various reasons why one could have stiffness. So it's beyond the scope of this discussion that we talk about this. I think we should have another dedicated day for that. So I think best you need to have a checkup. If you are in Bangalore, you can definitely come consult me. I can have a look and see. But whichever city you are in, we have a lot of good orthopedic and sports surgeons in India now, uh, who do a good job and who will give you a frank, good opinion on what exactly your problems are, and they can solve it.
So I will attach doctor's, contact details and everything in the video as well. So if you want, you can go and follow up with him, or else you can also contact with any of your doctors that you were consulting with previously, and also start working on your physio exercises. That is very important.
Harshad,
Yeah.
Harshad, since there is so many queries on ACL, let me just throw light on what an ACL is. Give me a second.
Yeah, sure, sure.
Now, am I visible here?
Yes, doctor.
So this is a model of a knee joint,
Uh-huh.
and this is the upper bone called as the thigh bone or the femur. This is the lower bone called as the tibia.
Tibia.
Now, this is an articular surface in the sense
Yes.
the surface which is articulating between the two bones is the joint articular surface, which is called the cartilage, and that's a smooth surface which aids in normal walking. And normal articular cartilage is usually pain free, and this is supported or cushioned by the structure called the meniscus. Basically, this is a shock absorber. That's what injury he had. This orange thing here is a meniscus, and that meniscus acts like a shock absorber in our daily routine activities or walking, standing, running, etc. etc. Now, this is a quadriceps mechanism which has got a kneecap or the patella bone and a quadriceps muscle and a quadriceps tendon, which becomes a patella tendon. This basically helps in normal walking and giving a strength in walking straight. If you do not have a good quadriceps, your knee can buckle and you may not be able to walk straight or run straight. Now, the bridges between the two bones, the structures which hold the bones together, are called as ligaments. A ligament is something which joins the two bones. And there are four ligaments in the knee joint. The two side ones are called collaterals, and the behind one is called the posterior cruciate ligament. And the most critical one, the inner one, front one, is called the ACL or the anterior cruciate ligament. Now, as you see here, it is the central ligament. And we all know that anything which is supporting centrally provides a pivoting stability.
Pivoting motion.
So what a function of a ACL is, one is it gives you a front and back stability. Second, it gives you a pivoting stability. So when you have a ruptured ACL, if you have a good quadriceps, you can still run straight, but you cannot pivot. It's simple. If you have a right knee ACL tear, you cannot play a left out on football. When you try to pivot and kick the ball, your knee will collapse.
This was very helpful, doctor.
Yeah, that's a simple
I think most of the people who asked about the ACL would, I think most of the people who wanted to know about ACL would get a clear idea about this after this.
It's very common. ACL injuries are very common. I see a lot of them on a day-to-day basis. In fact, even in lockdown, I'm seeing a lot of few of these ACLs torn. Not necessarily be it a sports injury. Somebody can just fall, twist their knee, and have an injury of this ligament.
So this is mostly because people do not train it like that. They need to understand that only squatting or only deadlifting is not the way. Or you need to train accordingly. Your pivoting motion is very important. Like you mentioned, dancers, they need to jump on single leg. So they need to train accordingly. That is one thing that they have to understand. So, doctor, I think these are all the questions that people had put in forward. So, finally, what are the advices that you would want to give to all the common people and the athletes equally during this lockdown phase?
There's no particular advice what I would give. I'm an orthopedic surgeon. Only thing what I can tell or share to them is be safe and keep a healthy mind and a healthy diet. Get good sleep. Be cheerful. Like look at Harshad's smile. That's a 100 watt smile.
Thank you. That's
if you have your smile reflects your mindset. We need to be. It's a very difficult situation, but we need to be happy. We need to be fit. We need to be in a positive state of mind. It's just a matter of time when we'll get past this. But to see the other side and to be healthy on the other side, we need to have our own preps now.
We need to be thankful of what we have rather than just crying over what we do not have.
Yeah.
So there is one more comment. Sir, we need to have a session on ACL. Surely we will we will try to keep a session on ACL. I think this guy, he liked the way you explained, doctor, about the ACL.
Yeah, we will definitely have one. Yeah. And all of us, let's be safe. How is the situation in Maharashtra now, Harshad? Are we good?
Yeah, it's better now. The cases are dropping slowly, but then again, people need to be, careful about their own health. They need to step up and they need to understand that, it's for their own safety.
Yeah, so exercise, sleep and diet also builds up our immunity.
Immunity, yes.
Yeah. So I think people with a good immunity are more better off in this situation. So we need to build our immunity, and we have learned this in the last 1 year.
So I hope everyone is safe as well. They stay safe and take out all the points like workout, keep a note of your diet, your sleep, everything matters. And there's one more question. My father has problems in his knees when he sits or stands, and we can hear his knees clicking when he sits. What could possibly be the problem?
I mean, by what I hear with the history, father in the sense he must have been elderly person,
Yeah,
uh,
I
whomever.
think he might be around 50, 55 plus. Yeah.
Yeah, so this could be a onset of an arthritis. This could be an onset of an arthritis. Arthritis is nothing else but a wear and tear of the knee joint. So if these are the early symptoms when a patient is having difficulty getting up from sitting position, having difficulty squatting down, having difficulty climbing stairs, or having difficulty standing for a long time. So this could be the earliest signs of an onset of an arthritis or a wear and tear of the knee joint. So one needs to definitely consult a doctor, get an X-ray done, and according to based on what grade of an arthritis it is, treated accordingly.
Okay. Does weight training help there as well, or resistance training in
Weight,
such
weight,
cases?
weight training.
Weight training, resistance training, for example, training your quadricep muscle, your hamstring muscle.
See what happens in arthritis, like in any other condition, the knee or the lower limb is not active as much as it has to be. The activity level of the leg comes down, and eventually the muscles waste. So one needs to do a basic exercises like basic isometric exercises are very good. So for the benefit of viewers, isometric exercises are exercises which can contract and relax the muscle without much of a movement. Without much of a movement. So these isometric exercises are very good in such osteoarthritic patients who have got knee issues without much of a mobility. They can strengthen the muscles around the knee. And definitely, based on what kind of an arthritis it is, your doctor or surgeon will suggest you accordingly.
So basically, just to clear it up, this is your concentric phase wherein you're, contracting the muscle. When you take it down slowly, that's your eccentric phase. And when you hold down the weight, that's your isometric exercises. So try to do all those kind of exercises for your legs. That is what the doctor is suggesting for now. And also you need to go meet the doctor.
Yeah.
Uh, so amazing session, so informative. That's one of the comment. So actually, doctor, it was very insightful. We should actually plan out another session on ACL as well. So I think this session must come to an end. It's more than an hour, and we can go on talking about it.
Yeah, yeah. Sports injuries are never ending.
Exactly.
Like,
There's
yeah.
one more question. Which graft is good for ACL surgery, patellar or hamstring? Can you please give scientific justification?
So, so as I said, this is beyond the
I
scope of
I
this
think this
session.
guy is a physio because the name itself is told physio. So yeah.
Yeah. So it depends on what kind of an activity the patient is doing, what is the profile of the patient. Both of them are good grafts. Based on which sports the patient is playing, one would select the graft. Based on is he a male or a female, is he hyperlax or rigid, kind of the body profile. So there's a lot of factors which determine the graft selection. So that is best left to the surgeon, and there's no blanket rule that this graft is good for so and so. It's all tailor made, and it needs to be taken a call by the surgeon and after discussing with the with the patient. Both of them are good grafts at the end of the day.
So I think that is it, doctor. Thanks a lot. Thanks a lot for this wonderful session, and you have answered all the queries that that we can possibly come across on this live session. We had a very good time. So thank you, doctor.
Yeah.
I hope we'll have a wonderful session again one more time.
Thanks, Harshit. Thanks for this lovely session, and we'll meet soon. And thanks for
Yes,
all the viewers for being patient and asking your questions and being with us this evening. Thank you all.
I'm coming to Bangalore, so we'll meet as well.
Yeah. Bye.
So, bye, doctor.